Hi, and welcome to the Healthcare CEO Show, where you'll find actionable insights on healthcare leadership from the best and brightest in the industry. I'm your host, Daniel Fernandez. Let's get a pulse. With me today, I have Francis LeGasse. Francis is the president and COO of Assured Assisted Living. He's also an innovator, visionary, entrepreneur, and he's a podcaster of his own. One of my favorite things about you, Francis, is that you're sort of challenging the status quo. And I think that anybody who wants to challenge the status quo, I would just love to have on my show. One of the things you're doing that, and one of the ways you're doing that, is challenging the way we view aging in this country.
Yes, that's definitely a pleasure to be here. I am, when we had our kind of intro chat before, this is going to be a great conversation. I think we're going to talk about some issues that sometimes we just want to avoid. We want to talk about it later. And the problem is all of a sudden it's later and we're like, wow, what just happened? So I'm really excited to share just some kind of the way I look at how we need to just tackle it and challenge it and start talking about it now. So we have a voice in how we age.
Yeah. And before we dive into that too far, let's start with your why, because I think the why is very, very important. What got you into this field to begin with?
It was really truly personal experience with my grandfathers. My paternal grandfather had dementia tied to what they believe Agent Orange from his 23 plus years of military service, couple tours in Vietnam. He was a very, hardy, big, strong guy. And just seeing kind of his, sacrifices of his career and then have that impact on his brain and what that did to the family dynamics and all that. And then my maternal grandfather had Parkinson's, and just seeing again the stress on my grandmother, the stress on my mom, that one was really evident because it was my grandmother and my mom who kind of took over those primary caregiving roles, and just watching the change in the family dynamics and just sitting back and wondering, can we do better? Can we look at this differently? And how do we make it more personalized where aging doesn't seem so negative, but aging is a blessing and an honor and an opportunity for us to share legacies with younger generations. And that's where I've, started to really focus on.
That's amazing. Now, I'm absolutely sure you have some thoughts or views on the current system. Mm-hmm. What are those thoughts on the current care model that's in place for a majority of America?
Yeah, I think we've settled for what the care model was back in the first nursing homes came out in about the first 40s or 50s. I think we've just made them look a little prettier. I think we've lost focus of the care model and we've put it more emphasis on the real estate or the grounds. You hear the phrase resort style living a lot, which I think is an amazing idea. I just don't think our execution is where it should be because we lose track of that care model, the belief that we have to be providing a high level of care for our residents, our family members, and it can't just be how the building looks. So I think we need to kind of put aging on its head, take a moment and kind of almost a time out and say, hold on, is our current building designs the best way to encourage a positive aging experience?
So you're thinking about things from a fundamental aspect.
Yes.
Well beyond the structure and the typical processes that are in place today.
And I think we have to. I mean, if you think about it, I have a physics degree, and a lot of my friends, I graduated from University of Michigan, which is a good go blue, by the way.
Right.
And we have a lot that went into tech and all these kind of sexy or cool, up and coming industries. And, I always get that question. I started when I was 27 in this senior aging services, and people are like, well, why? I'm like, because I think we need the best and brightest and most creative to look at this industry just how we look at technology, right? I mean, we have some amazing technology. If you think about the first smartphone to where we are today in 10, 11 years, it's changed a lot. So when we put our best and brightest on things, we can have fundamental, monumental impact on a wide range of opportunity. And that's what I think we need to do for aging.
Right. And in that vein, sometimes things are done because it's just the way they've always been done.
Correct.
And you just really need to rethink things, like you said, from a fundamental standpoint.
And COVID's done that though. That's, I think the best thing is we are at this disruption point, this point that we are taking the pauses and going, does this make sense? Or are we doing it because it's the way it's always been done?
Right. And Speaking of COVID,
Mhm.
what did it look like earlier in this year? I mean, what sort of impacts or how did it impact your business?
It impacted it from more of trusting our systems. And what I mean by that is we had some pretty rigorous systems that we went to very quickly. I mean, we locked down our buildings to almost all visitors. The March 6th was when our team decided that we're going to be proactive. And once we had one case in Douglas County, which is just outside of Denver, we locked them all down. I don't think we were the most popular at that time. The people might have thought we were a little overreacting, but what happened in Washington State was, made us think really hard about this. And then it was really trying to adjust and adapt fast and quickly to be as much ahead as we could, whether that's from how we handled our staff or how we handled presumptive or all these things that we began to just build policies on the fly and implement them. And then it was a stress, though. Once we got that settled, it was definitely a stress of acquiring PPE. And that was a real challenge of how, because there was some price gouging, some supply shortages. And it was that aspect was like, crap, if we need this stuff, we need it in now and we need it efficient, but we can't, what is it going to look like financially? So it was just a lot of unknowns that we began to work through. But our team, I am so proud of them. We have an amazing team. Everybody responded and adapted quickly and efficiently. And we did a pretty solid job. I think we can always do better communicating with families. That's one of our main focuses of improving communication amongst family members. We did some pretty good stuff with that, but it's pushed us to just do better, to be better, to think outside the box and to challenge these unknown problems, as dynamically as possible.
Yeah. So, I mean, in talking with other CEOs, I think everyone is in agreement that the world will look a little bit differently once we come out of this. What does the future of senior care look like? Are there some things that have happened maybe today that will change our mindset as we move forward, maybe?
I think it's going to be one is the welcoming of new technology. I'm hoping comes out. We're using some new technology that's, again, startups to improve our communication, to make it more efficient, to make it easier. I think we're going to take a pause as to seeing about telehealth. How does telehealth improve the lives of our older adults living in, aging environments? I think we're going to take a pause at how our design is, what our engagement looks like. I think we are at a great point to finally say stop. The way we are taking care of our older adults right now is below par, collectively. I think there are some great organizations doing amazing things, but I think collectively it's time to stop settling for what our designs and our ideas were aging from the 40s, 50s, and 60s. It's time to really give a voice to everyone on how they want to age so that when they get to that point, they're aging almost mindfully, not because this is the default.
Yeah. And speaking of when they get to that point, I mean, historically speaking, when they get to that point, we typically look to isolate them or they're being isolated. What are your thoughts on that?
I think it has unintended consequences. I think when the majority of the states went to this really rigid lockdown for their long-term care environments, I think it was a necessary evil for a short period of time. I think right now, a lot of them have gone to outside visits and all these other things, which I think is great. I think the more we isolate any group of people, they're having cognitive decline. They're having the withdrawal symptoms. They're having that isolation, the depression, all those other things that we know just happens to everybody. Now put on aging, now put on a pandemic, now put on they can't see their family. I mean, you're just snowballing things. And so I think that's what we have to look at aging is we live right now in communities that are a collective group of young to old to everything in between. Why do we think at this point that because we're older or we need a little more help, we have to go live with only that group?
Right.
When did that become good to segregate based on our physical or age? And I don't have an answer because I don't think there's ever a good reason to.
Yeah, I couldn't agree more. This has been probably a major stressor on everybody around the world, but especially for some of the people that you're caring for, but how about the people that are then caring for them? How are we taking care of them? And how are we as employers should we be responsible for helping to take care of, our employees as well?
I think we need to, one, give recognition, and I mean a tremendous amount of recognition, to our direct caregivers or direct teams, whether that be your administrators, your executive directors, your CNAs, your home health aides, however you want to title those amazing, those amazing, compassionate, driven individuals. I think when you look at your strong aging services company, yes, your leadership matters to an extent, but if you don't trust your boots on the ground, you don't trust your frontline staff, you don't give them every tool possible to be successful, to do their job as efficient as possible, I don't care what you do as a company, you're missing out, because your direct line people, whether they're licensed or unlicensed or anywhere in between, from the janitorial staff to the housekeeping, they are what matters. And I think we need to recognize that and do a better job collectively to improve what opportunities we provide to our employees, what benefits outside of just pay we can provide to them, whether that be housing, transportation, whatever it is. Because I believe that to solve some of the housing issues that we have, or the expensive housing, employers need to take a pause and see, what can I do to benefit my employees? And so, we do offer some housing for a lot of our direct care staff as part of their employment, and that has been a huge help for us. We have been bringing, we bring some food in with groceries as well too for the team, so they don't have to go out as much. So those are things that we've been doing even prior to COVID. But I think we have a, affordable housing issue in many states. And I think employers can have a positive role in that. I don't always think that government's going to be able to solve that. I think we can begin to offer benefits besides just the pay.
Wow. So essentially employers taking a more active role in the well-being of their team.
Because if you do that, your turnover is reduced, right? I mean, why do people leave to go? We've created this culture of a top-down philosophy, I think, in many of our organizations, and maybe that's because of the stock. I don't know why, but I feel like back, we had a different philosophy of what a staff member or employee was. It was this person we wanted to cultivate and grow with, and it was this idea that we work together. It's not them. It's not always this hierarchy of the top down tells what's going on. And I believe that we have to be listening more and figuring out how to implement the suggestions from our team that works directly with the staff, with the residents. So that's where we have to cultivate together. And I think that when you do that, you're going to see better retention. You're going to see better care outcomes, and you're probably going to see a lot happier people across the board.
I agree with you. My father ran a company with thousands of employees, and he always said, don't befriend anybody. You're an executive, an elitist. You don't need to, they're all replaceable. And that sort of, those mindsets are just so.
And I don't know. I've always believed, that my dad taught me, and my mom too, from a young age, that we treat everybody with the same level of respect, no matter if they're, an entry level employee, a janitorial, whatever that may be, to the executive level. And I think our ideas of what corporations are obviously constantly shifting, of course. But I also think too, when you look at the core of what we need to do when we're taking care of people, humans taking care of humans, you need that touch, that compassion, that emotional connection. And if you're stressed about other things at home, you're not always going to be able to do that. So if we as employers can take some of that off their plate, reducing food insecurity or housing insecurity, we might have just freed their mind of a stress that they don't have to worry about anymore.
Wow, that's beautiful. That's a lesson that can be learned and used in any industry. And that is a beautiful, beautiful thing.
I appreciate that. It's not always easy, but I think we can do it. I know we can. And that's really what I believe is that, why I was excited to talk to you is I love what you guys are doing, because I know we can have an impact, not only through discussion, but through action as well too.
Right. And part of it comes from having these conversations and getting the message out, open and honest conversations. There's so much uncertainty as we look ahead, because it's really hard to kind of paint a picture of what it's really going to look like. Are there any policies or, procedural changes you see coming that people should be aware of?
I think the big one that we're going to continue to see is these health screenings for entry into any long-term care environment. I think we're going to see that, which I like. I don't mind. I think it's a good idea, especially during cold and flu season, because we are always hyper worried and concerned during cold and flu season. So COVID, a lot of things we did for COVID, we had some systems in place for cold and flu, not to the level now, obviously, which I think we've done a really good job with, like symptom checking, tracking of both residents and staff and all that stuff. That is really good. I think we're probably going to see some more consistent mask use as well too, for long-term care environments for a long time, much longer maybe than the general public, which if you look at it, I think it's a positive right now. I do want to find ways though, and I know there's some clear masks and stuff like that out there, so the residents can see expressions, and especially if you're, have hearing issues, a lot of them will read lips, right? So if I have a covered mask, you can't really tell what's going on. So I think that's some things that we're going to continue to see. I think we're going to continue to really monitor health a little bit better in these environments, really track symptoms and be more responsive to symptoms as a way to be preventative in care, or proactive in care, not preventive, but even proactive in care. Policies, I'll be really curious to see what government, both from state, federal, local governments do, because I think you're seeing a strain on a lot of the Medicaid providers or low income providers, because their costs are rising faster than their rates are reimbursed. And especially, what are we going to do for that? I think this again gives us that pause of, where does long-term care housing, not just the medical care covered under, Medicare and all that, where does long-term care housing fall into the financial model here? Which it's often overlooked that we think the medical care is all that matters when you age, but there's a housing component that a lot of times gets slipped through the cracks.
Wow, that is amazing. In terms of lessons maybe you've learned over the last 6 months or so, mm-hmm. What sort of lessons would you share with a CEO, or mm-hmm. maybe even a physician or CEO or president listening to this podcast right now, that you'd want them to know?
I would want them to know that you have to be willing to adapt. If you think that your current philosophy or ideas today are the only way to move forward, I think you have to be prepared to pivot and be adaptable and overcome the challenges that we face. I believe that if we are too rigid and not keeping a sense of a little bit of that paranoia in there, but also that mindset I can overcome, that we have to be ready to be dynamic in what we're doing. I think if we're complacent, we're already possibly out of business and don't even know it. And what I mean by that is not saying we're out of business tomorrow, but are we going to be relevant in 5 years? Are we going to be relevant in 10 years if we're so fixed on the way we do things today? Yeah. Because adaptability is one thing we've learned over the last 6-7 months, because every day I feel like we get a new change in the regulations or update from the CDC or the health department. It's like, okay, I guess we're doing that now. So it's like we are just adapting and overcoming and trying to, be proactive in what we're doing.
Yeah. Do you find that is probably one of the greatest challenges today? There was a time when you could plan out the next 5 years, but now it seems as if everybody's shifted towards, what does the next 45 days even look like?
Daniel, yes, that is correct. And I think your good companies are going to forecast creatively. We're going to push the envelope. We're going to look beyond the challenges, but we're going to look at solutions and work the way back. That's what I think really matters, is that, okay, we know we need to have these preventions in place. We know we're going to get different curveballs thrown at us. But if we set our standards above the minimum, we can be proactive in what we're doing.
In closing, is there anything you would like people to know about senior living?
Senior living has a lot of opportunity for us to have an impact today. It's not stuck. It's not rigid. We have an amazing opportunity to give our older adults the aging experience they want, but we have to start by looking at what we can do and how we can change. We have to get away from the mindset of what we currently have available is the only way to age. We need to look at other cultures, other nations, even other nationalities and how they're aging, and see how we can best create best practices maybe across the globe or across our own state to share these ideas of how we can do it differently or better. I don't want anybody to feel scared or worried or concerned about aging, because I truly do believe it's an honor and a privilege to get older. A lot of people don't have that privilege, and we have to stop looking at aging as a burden, but as an amazing opportunity to share history, to share love, to share stories, so that we can grow together as a community.
I love that. Thank you.
No, that's just how I feel, man. I mean, it's been a wild ride for almost 11 years now. And I just trying to figure out, as my why is obviously goes back to my family, but the more I meet people and the more families I work with, it's this trepidation of I'm scared. And, when did it change from we're going to help, each other or even just our older adults to we're going to do the bare minimum? It's like, I mean, that's, what we're only going to live good for 40, 50 years. And then after that, it's like, yeah, you're aging. I mean, it's like, that doesn't make sense. And we've got to get back to that mentality of we're in this together, whether you like it or not, and we've got to just look at it as like, this is cool. Like there's so many cool things we can do. And, we can learn from each other. Even we can learn from our, 90-year-olds, 100-year-olds, and we can learn from our 2-year-olds as well too. So it's that whole idea that we just have to have some fun, have a lot of fun with it too. It doesn't always have to be serious. I mean, everyone's like, you got to be serious about aging. Well, no, life is fun. If life's not fun, what are we doing?
Yeah, I agree. I mean, they've been on this planet a lot longer than we have. There is a lot that we can learn. They have seen all of the things that have happened,
And I've seen that, like, think about the toughness of those growing up in the Great Depression. Like, is this pandemic anything really to them? Maybe not, right? I mean, I'm not trying to downplay it, but that's tough cookies. Like, you're growing up in the Great Depression era. I mean, that's a different level, I think, than any of us will ever comprehend. And so let's lean on those older adults on their toughness.
Yeah, so that's exactly it. That reminds me, there's a Truman quote that says, the only thing new in history is a history you don't know.
I like that. I like that a lot. That's a really, really good quote. And I think it's very, important to acknowledge that, because I think sometimes we don't always pay attention to history.
Right. I agree.
So, yeah.
Well, I want to thank you for being a guest on our show, and genuinely from the bottom of my heart, thank you for sharing. I can tell you're very passionate about this and it comes through. And I know that, anyone listening will pick up on that and it will resonate with them and we'll get the message out at the end of the day.
Absolutely. And I really appreciate, what you guys are doing and having these discussions and really encouraging people to just learn more and listen. And I think that's really important here. So I thank you for the opportunity, a true honor, and it's been fantastic. And I've really enjoyed our discussion.
Thank you for joining us on the Healthcare CEO Show. If you've enjoyed this episode, don't forget to subscribe on your favorite podcast platform for more insights from the top. Until next time, lead boldly and care deeply. See you on the next episode.